Good day, everyone. I'm Natasha Heyman, a member of Cohesive's marketing team, and I'm delighted to be your moderator for today's webinar. Our topic is building a digital healthcare state for the future. Before we dive in, a few administrative and housekeeping notes. Firstly, all attendees are currently in listen-only mode. Feel free to absorb the insight that we'll be sharing. You can post any questions that you have either in the chat box or in the Q&A bar on your screen. If we can't address all of these during the webinar, rest assured that we will follow up with answers afterwards. Today's session will be recorded. You'll receive a copy, and we'll also repurpose the content on the Cohesive social channels. Thank you for joining us, and let's start the webinar today. Dave Philp and Olly Thomas will be hosting this webinar on the role of digital data and technology in the effective management of your healthcare facilities. In today's focused 30-minute session, we will be covering digital solutions for the healthcare outcomes, explore how digital technologies are transforming healthcare outcomes. Secondly, learn about Cohesive's impactful work in this domain. Our commitment to driving positive change extends beyond theory. Olly will be sharing some real examples in terms of how Cohesive can assist you on this journey. And then Olly will also spotlight a unique opportunity, for example, the UK PFI Handbacks process. We will discover how this process can also pave the way to a digital estate. Let me introduce today's speakers to you. Olly Thomas, Cohesive's Director of Buildings and Communities in EMEA. Olly is an AEC professional specializing in digital transformation. With a background in architecture, he has led various roles focusing on implementing digital strategies. At Cohesive specifically, he's the Buildings and Communities Sector Director, where he's managing teams and advising our clients on the digital impact, focusing on people, processes, and technologies. And secondly, Cohesive's Global Chief Value Officer, Dave Philp, has over 30 years industry experience and is a chartered construction manager by background. He has previously worked with Balfour Beatty, Mays, and ACOM. As Chief Value Officer, Dave is responsible for driving customer centricity and creating sustainable value for our clients across their asset lifecycle and portfolios. Dave, over to you.
Thank you, Natasha, and thank you everyone for joining our webinar. And Natasha mentioned in the opening, I think we probably mentioned it twice already, that word transformation. And I think what we're seeing is our built environment is experiencing transformation in how we apply digital technologies and how we derive new data insights and how it supports in terms of improving design, construct, and how we better operate our healthcare estate. Always going to talk about this a bit more later on, but at Cohesive, we believe that a good healthcare estate provides a crucial environment for clinical excellence. It also supports patient-centered care, well-being, and I think ultimately, if we get this right, it's about supporting economic growth as well. And as you can see, we've got a simple hypothesis that we've been testing at Cohesive in terms of the digital estate, that healthcare built infrastructure, especially our buildings, is closely intertwined with patient satisfaction and user outcomes. And that can be from clinical allied professionals, it can be user groups, and those that use, if you like, our healthcare assets. But it's as simple as that we believe that better, more connected data about the assets, but also the complex systems as well within healthcare are going to help understand how our assets are performing and how we can enhance and support patient-centered care models in there. But it's trying to create that linkage, if you like, between the physical estate, digital estate, and better healthcare outcomes. And whilst we are observing this at the same time, what we're seeing with our clients is the healthcare estate is experiencing a period of, I think, both significant investment and indeed significant change as well at the same time. We're seeing a lot of our customers having to do more and better with the assets, the healthcare assets they already had. How do we sweat it better? But also at the same time, if you like, their side of the same coin, we're seeing new capital investments are looking at much more digitized hospitals that will be transformation. So it's trying to be able to create both of these. And at the same time, we're very mindful that this is all being played out in the backdrop of a sector journey often towards net zero or sector decarbonisation as well. And probably one of the biggest challenges we recognise we've got to face as well, that many existing hospital aspects, they're not operating efficiently, or as they were designed. And I think we see this in terms of digital estate as being a great opportunity to improve the performance of, if you like, the healthcare estate and the outcomes that they provide as well. So Natasha, if you can move to the next one, please. So you can see there, this is our overall model in terms of a real macro level, in terms of the digital estate. And simply, how well our healthcare estate performs, or your health estate performs, can bring much wider benefits, not just to you as a customer, but to society, the communities you serve as well. And by creating this digital environment, we can reduce the carbon that hospital assets generate, but also, back up the top in terms of the healthcare outcomes, we can improve that healthcare recovery time of occupants, improve patient journeys. And again, it's not just patients, it's the clinical allied professionals that use assets. We can reduce delivery and management costs, and ultimately, it's about improving healthcare outcomes. And you can see there our model, it enables a line of sight between the digital estate and the healthcare outcomes at the top. And it's hugely important that we can communicate it. You can see two pathways as well by connecting these assets up. As one side is about better performing assets, asset optimization, resilience. Another side, again, through data, insights, and decisions, how we can create these better patient pathways in terms of what that looks like. Ultimately, effective performance management of the healthcare estate is going to be a key enabler of achieving that sustainable and inclusive net zero healthcare environment I mentioned at the very beginning as well. The whole idea of the digital estate is giving us understanding, and it helps us respond to, if you like, the key information. And it's an opportunity to increase efficiencies, improve the well-being of all healthcare stakeholders. But the big part is by connecting, if you like, the two environments of the physical and the virtual environment, we can create a better understanding of how healthcare buildings perform at both a building but individual system level, and indeed across the whole estate. And then the big part as well, through data-driven insights and decisions, we can actually act upon it as well, which is hugely important. But really the centre of it, as you can see, between the physical healthcare and that digital estate is, if like, creating the data link between these two environments, making use of international standards in terms of information management, ISO 19650, and indeed looking at it in the context of asset management of ISO 55000, that gives us like a solid platform, gives consistency in terms of what we're doing. But more than anything, gives us the opportunity to provide integrated data from, it might be in terms of operation, but it might be other healthcare data sets such as infection control, to give it context and support clinical decision making as well as asset management. Ultimately, a big observation from us, we believe that never before has technology offered such opportunity to address the challenges of healthcare estates. And what we're seeing, especially in the last couple of years, the growth of new solutions and approaches to connect the physical buildings, digital models, enable analytics and tools, will enable your hospitals and healthcare assets to become smarter, optimize their performance. It's also going to support, if you like, frictionless data integration and support your decision making, which might include remote monitoring, digital flow, wayfinding, and asset location and tracking. And hopefully the digital estate model you see is going to build new capabilities for you as clients and operators, improved understanding of your buildings across the portfolio, and ultimately improve the outcomes that they seek to deliver. So Natasha, you move over one more, please.
I think we're still good with the screen.
Sorry, I've lost it up at my end. Sorry, it's kind of dropped off.
Okay.
Sorry, 2 seconds. I'm going to try and get it back.
No worries.
Apologies, everyone. There, I'm back. Sorry, Google Webinar was doing a bit of an update there. So you can see that the big thing is there's been a huge amount of value in terms of linking the information to our assets. Now that might include electronic drawings, models, building information model, it might be equipping schedules and specifications and other documents, especially around operation manuals, and be able to have an accurate record is hugely important. The other thing they say as well, it's the big purpose of a digital estate is support joined up decision making. It's going to give them dynamic insights and lead to better healthcare outcomes, as we said at the beginning. Can you click one more, Natasha, please? And you can see in terms of their definition, I think it is interesting. It's very much about an information management-led approach. So when we talk about ISO 19650, it's a standard for information management. The big part within there for them is about the digitization, integration, and importantly, the curation, if you like, of their digital models, especially existing data within there. But as a key word, I think, it's about appropriate and proportionate levels of digitization that meet the needs and the outcomes of those assets at a real estate level. And some of the key clues they've got as well is it provides them with an enterprise level of searchability about reliable information. And think about that in the context of recent events just now in terms of reinforced autoclave concrete. How many surveys we see people having to go out and actually resurvey. But if you've got a good digital estate, you can actually find information that's searchable there, mitigating and ameliorating that need within there as well. But ultimately, a bit like them, it's supporting better healthcare outcomes. One of the things up in the top right-hand side, you'll see they've also taken, if like a human-centric approach to it, and thinking about the different roles, having a digital estate champion. Someone's going to have the voice of the customer with their right the way through it. They need to think about pilot projects, the managing of the technology architecture supports, and the lessons learned. But the big part as well, as you can see in that bottom point in the top right, is it can take a while to create a digital estate, but it's always got to stay evergreen. And that needs to have a champion that's going to make sure it's always effectively curated and that information continuously updates. So I'm going to move on once more, please. So I think more important to what a digital estate is, what are the characteristics there? And one of the things that we often use, it's called the Gemini principle. So it's a framework that was created by the University of Cambridge Digital Built Britain programme. And we've used it and adapted it to try and look, and again, I would recommend that you do the same for the architecture of your digital estate, or something we can help you with, is looking at what are your key characteristics. You can see 3 swim lanes that we believe are hugely important for both a digital estate or indeed a digital twin. Number 1, if you are going to digital estate, it should be driven by purpose. It should have very clear purpose. It should be aligned and driven by the healthcare and asset outcomes that are your goals. It should create value, but value that's tailored to meet your performance improvement needs rather than being generic. And again, it should provide insight that is demonstrable and again linked to your assets and your patient journeys. One of their big things is if people are going to use it and adopt it, it needs to be built upon trust and information and data. It's going to be trustworthy. So therefore, it's got to be secure. It's got to be security minded. It should be open, but again, in terms of the confidentiality, it should be designed to be open as appropriate and proportionate to actually its needs. And one of the big things, especially if you are going to move on to the world of digital twinning, it should be built upon data that's an appropriate quality, that's verified and validated. It should also function effectively as well. A big part of the digital estate is that ability to join data together and contextualize it. So the federation and connection of data built upon a standard model. As we mentioned already, that ability to curate it, for the next 10, 15, 20 years, that asset life cycle across your portfolio is usually there. So making sure there's governance in place as well. And it will evolve. One of the things we mentioned is we've seen huge transformation in our built environment in 10 years. Both technology will evolve, healthcare will evolve as well as your asset strategy will. So making sure you can future-proof your digital estate strategy and it continues to grow. But use this as a great way to test, if you like, your digital estate strategy and your needs using this framework as a bit of a basis. If we move on again, please, Natasha. One of the things as well is once you've built that framework is to look in terms of, we believe digital estate should be motivated by the use cases, the outcomes that they're going to achieve. And we use this framework. Number 1, start off with the North Stars. What is your key objectives that you're trying to achieve? Trying to link it across your overarching healthcare and asset management outcomes. Now, once you do that, these North Stars, if you like, will start to inform, if you like, the outcomes that you're starting to seek. It could be anything from improved productivity, it could be improved safety and resilience. And that starts to inform, if you like, coming down that hierarchy into your value propositions. You can see we generally break it down into primary use cases and secondary use cases. Again, it could be in terms of how you better improve your management of assets, the safety and resilience, but then you start to break it down into the more detailed ones within there. Now, Once you do that, you can start to look at the long-term impact in terms of what that looks like. It might be improved operational performance. You look at the associated key performance indicators you want to improve upon as well. It might be in terms of improved unplanned outages, and also think about what key competencies you need and it's going to build as well. And probably the big part about digital estate is thinking about data and information. What's the information and data that's going to support the decision making that you need? But really think about the outcomes and be driven and motivated by the outcomes rather than doing it just for the sake of the digital estate. So clear strategy, clear outcomes, and trying to create an impact pathway such as this. Again, just moving on, please, Natasha. And as well, think about the architecture. You know, technologies and data are a big part of it. Think about the flow of information through your estate. As an issue, it's going to come in. It might be coming in from design teams. It might be from your framework contractors. It might be from maintenance contractor. How the data is going to flow in through contract lines into what we call the project information management or model and the common data environment. Now, the first part, if you like, of the digital estate architecture about trying to use a common data environment as a means of reliable digital representation of your healthcare infrastructure. That big picture of all your information. Again, as I mentioned, it could be from your drawings, PDFs, it could be CAD, it could be models, linking that together with operation and maintenance, asset documentation and data. You may also wish to link it across to your geospatial so you can locate it. And increasingly, photogrammetry might be convinced from your mobile phones or iPads and point clouds that's going to give the geometry as well. And I think one of the biggest parts of the integration is how you can integrate it with your asset management systems, especially from data that can flow into asset registry, into your computer-assisted facilities management and the ERP. And there's a huge value in terms of that digital representation, be able to search right across the whole of your systems and be able to do joined up decision making. And once that's in place, you can then sort of move on and mature across it, where we're starting to move more into the world of digital twinning. And if like digital twin actually builds upon that first part, we were now starting to move into the description and state of the healthcare infrastructure, often in real time. And thinking about in terms of connecting data points, it might be in terms of SCADA, it might be your building control systems, or other IT or operational technology systems and sensors within the healthcare environment, especially equipping. And again, I think a key part in terms of decarbonisation is the energy systems as well. And finally, across that white line is thinking about the capabilities, be able to do something with the data analytics and mining, increasingly using tools in terms of machine learning, AI to support your decisions, and ultimately, increasingly, this has become a common thing we're doing now, is that campus level live view of your assets, how they're performing, and be able to create that top hat visualization across all your data. So hopefully that's given you a bit of food for thought in terms of the importance of the digital estate to support your healthcare outcomes. Need to think about a strategy, be driven by the outcomes, and start to think your initial technology architect well. So you've heard from me, I'm going to now pass the bat on to Olly. And Olly's going to talk about in terms of what Cohesive doing in terms of delivering digital healthcare outcomes. So Olly, over to you.
Thank you, Dave, and thank you, Natasha, and of course, thank you to everyone for attending this afternoon. So, Natasha, please move forward one. So, I'd like to take the opportunity to, as Dave has noted, talk through some key areas where Cohesive are helping to support digital health outcomes within the sector. As an organisation based on our very specific subject matter expertise in digital strategies, information and data management, combined with our domain experience in the built environment and our specialist knowledge that intersects IT and design, construction and operations of assets, we've worked with a number of end clients directly alongside augmenting our comprehensive partner ecosystem with specific capabilities, a selection of which are shown on screen and many that you'll be aware of. Furthermore, as a business, we're very fortunate to have a number of individuals who have worked in clinical settings themselves as part of end client organisations, which really deepens our domain knowledge of the physical and the clinical aspects of the healthcare estate and the important role that digital can play in enabling healthcare outcomes accordingly. So building on what we've heard from Dave today, I thought it'd be good to highlight a couple of opportunities and industry drivers that are supporting the development of digital estates, looking at two distinct programs of slightly differing scale, where these opportunities present themselves and where Cohesive are helping clients, namely the new hospitals program from a strategic advisory perspective, and the PFI handback and expiry program from a more technical, pragmatic boots on the ground perspective. So Natasha, if you'd move forward, please. From that national perspective, the new hospitals program that I'm sure everyone will be aware of, the program has digital at its heart. It provides a real opportunity to develop a digital estate at scale as part of a wider drive for an intelligent hospital framework, which brings together the digitization of the assets, the digitization of the physical, the digitization of the business, and the digitization of the services that ultimately, when brought together, can deliver better healthcare outcomes for a number of key streams. Digitally empowering patients, so ensuring that patients are able to be more engaged, informed, and become more active partners in managing and monitoring their health and well-being, promote the self-care and active engagement with healthcare services in the hospital and within their communities. To digitally enable the staff that work within those hospitals, make it easier for healthcare staff by equipping them with the right tools and the skills to allow them to focus on care delivery and delivering the services that are required to create better health outcomes. Create interoperable and intelligent systems to drive efficiency, effectiveness, and productivity from data that is generated and captured within the hospital and beyond the hospital walls, enabling the better decisions to be made faster and cheaper across the physical asset, the business, and the services that are being delivered. Create the concept of hospitals without walls that support integrated care, enable the delivery of an integrated health service that spans not just from the hospital itself, but into the community and to the local.
This way you're doing that, Ollie. It's interesting to see when you bring the field together, outcome sits right at the heart and the centre of it, doesn't it? And I think that's what it's all about, isn't it?
Yeah, I think we're going to see outcomes at each of those bubbles, if you like, but I think the real value is when those bubbles come together to create that focal point and where the real outcomes are going to be delivered. Thank you, Natasha. So just in terms of the new hospitals program, a quick overview of where Cohesive are supporting that program. So we've worked with NHS England and on the program over a number of years now, providing strategic advisory services. As everyone will be aware, NHS is NHP or NHS, but NHP as well is complex. There's multiple tiers of organisations needing to create, share, and use data, and this causes several challenges, which include, but are certainly not exhaustive, with regards to the complexity of the information to support program level activities around insurance and governance and ensuring that it's moving at the pace it needs to. The aggregation of said data across multiple use cases and multiple tiers of organisations. The creation of a common language to promote that integration across the whole program and the supply chain, and the ability to exchange information in a common way that is understood by all. And of course, the specification of said information and data and the associated standards that need to sit behind it to make sure that the right level of granularity across the program and across the supply chain is being captured. So how are Cohesive helping to address these challenges? Well, firstly, we developed a digital approach for the program, which was sat alongside a roadmap to really provide the foundations for delivering an NHP program that drove certainty in the delivery of the new hospitals and enabled that collaboration between the NHP and the trusts. Deploying our strategic advisory services and our advisory services framework, we were able to work swiftly and quickly with the end client to enable that digital approach. Secondly, and as part of a current live engagement, we are now working with the interim delivery partner to support the program to start to define the actual requirements and standards and the governance around it that is going to enable a technology and ecosystem to form what is being called a connected data environment that will allow that integration of the data and information at all levels of the program across the clients, the trust, and the supply chain to really start to build around those pillars of the intelligent hospital that we talked about in terms of the interoperability required and the smart buildings piece, and enabling the then of those three bubbles to come together to create those outcomes. Step forward, please, Natasha. From another program perspective, but from a more technical perspective, as I mentioned, we're also seeing opportunities for clients to start to build digital estates through other drivers in the industry, such as the PFI Handback program. The PFI Handback program, the private finance initiative, put in place over 600 projects across the UK that are set to expire before 2040, with around 150 of them in healthcare alone. As those contracts reach expiration, there is a number of complexities that the receiving authorities will face, but one of them is around the suitability of the asset data that is going to be provided alongside the physical asset itself. And of course, the association of how you transfer that information and data back into the existing estate to operate and maintain it as business as usual, and to ensure that from day one the services being provided from that asset are continue to do so, and create an ability to enable future services. There are significant challenges, again, like NHP, around information and data in terms of what asset data is actually available, what format is it being provided in, can it be verified and trusted by the authority receiving the asset, what information is actually required and what might be missing, and how is that information going to be digested back into business as usual by the trusts. And whilst addressing the initial priority matters of the handback of assets under the PFI is a priority of many, we're actually seeing this as an opportunity for trusts to rethink and review the way in which they capture, use and manage data about their assets across their estates, and can create the opportunity to start to rethink the way in which you do so, perhaps enabling the opportunity to create a wider digital estate as part of your operations strategy going forward. So how are we proposing to help clients with this? Natasha, if you could move forward, please. So as the handback program starts to come into effect, we're looking to work with PFI contracting authorities, those receiving the asset back, to establish a baseline for a rapid asset data readiness assessment for clients to understand where they are now, where they need to be, and what are the gaps between where they are and where they want to be in the future in terms of handing back that asset. The purpose of the assessment is to rapidly equip the client with the intelligence that they need, working with our experts and the extensive experience and knowledge that we've outlined, in order to achieve an effective and efficient handback and make sure that the information and data you need to enable that ongoing operations of the asset is present. So using that experience that we've touched on the readiness assessment, we'll capture detailed information, answer about key questions in a format that can be reused by yourself internally, and can also be used to feed into the formal expiry health checks, which should be conducted by the Infrastructure Projects Authority 3 times ahead of expiry in 7, 5 and 3 years. Or, as we say, could be used in isolation to support your expiry and planning process. The intention is to work alongside your teams, being really mindful of their time and their day job pressures, and make sure that we make the best use of any engagement with you in order to move forward. With findings being reported in a report, which you can use as a foundation